It's Wednesday, November 27th, and this is the Daily Medical News by MD Edge, where we bring you the top headlines in clinical medicine as well as an in-depth look at the day's biggest story. I'm Nick Andrews.
And I'm Mary Ellen Schneider. Today, regular disinfectant use may drive up COPD risk.
There's more research underlying the cardiovascular danger for gestational diabetes.
Cancer-related pain continues to rise, as does prescription opioid use.
And chronic pain is more common in women with ADHD or autism spectrum disorder.
Plus, why atopic dermatitis might not be one disease. But first, thanks to all of you who've helped us make this podcast better by completing our short listener survey. If you haven't, you can take the survey by following the link in the show notes. And now, the news.
Consistent occupational exposure to disinfectants may boost a patient's risk for developing chronic obstructive pulmonary disease. Given the finding, clinicians should consider exposure to cleaning products and disinfectants as well as other occupational exposures when treating patients with COPD. French researchers analyzed data from more than 73,000 female nurses who had no history of COPD. The nurses completed questionnaires every 2 years for the Nurses' Health Study 2. Those who used disinfectants weekly saw a 35% greater risk of developing COPD, and there were more associations in nurses who used disinfectants to clean surfaces and to clean medical instruments. High-level exposure to certain disinfectants, including glutar hydrate, bleach, hydrogen peroxide, alcohol, and quaternary ammonium compounds, were significantly associated with increased risk of COPD incidence. These data appear in JAMA Network Open.
Cardiovascular risk factors may be elevated as soon as the first postpartum year in women with gestational diabetes or hypertensive disorders of pregnancy. Dr. Deborah Arenthal is at the University of Wisconsin in Madison. Speaking at the biennial meeting of the Diabetes and Pregnancy Study Group of North America, Dr. Arenthal cautioned that the metabolic stress of pregnancy can uncover underlying susceptibilities. Dr. Arenthal was a co-investigator in a study that followed more than 4,400 women 2 to 7 years after their first pregnancy. The researchers found that women with hypertensive disorders of pregnancy, such as preeclampsia and gestational hypertension, were 2.5 times more likely to develop hypertension during follow-up than women without HDP. And women who had preeclampsia specifically were more than 2 times more likely than women without preeclampsia to develop hypertension at follow-up. Based on the new lower 130/80 threshold for hypertension, the disorder afflicted 37% of women who had experienced HDP and 32% of women who had gestational diabetes.
Cancer-related pain was more common among patients in 2019 than in 2018, and the use of prescription opioids and medical marijuana also rose significantly. That's according to the American Society of Clinical Oncology's National Cancer Opinion Survey. Patients who have or had cancer were significantly more likely to report that they were currently experiencing cancer-related pain in 2019 than in 2018, at 19% versus 12%. Nearly half of patients diagnosed with cancer said that they had not used anything in the last 12 months to manage pain, nausea, or other symptoms. Among those who had, over-the-counter pain relievers were the most common method used. Prescription opioids were the third most popular choice for symptom management in both years, but their use was significantly higher in 2019 than in 2018, at 17% versus 12% respectively. Also showing a significant rise from 2018 to 2019 was the use of medical marijuana, which went from 5% in 2018 to 10% in 2019. The Daily Medical News will be right back after this.
Women with ADHD autism spectrum disorder, or both, report higher rates of chronic pain, and treating those conditions might in turn reduce the pain. Researchers at Sahlgrenska Academy Institute of Neuroscience in Sweden analyzed pain symptom data from 77 Swedish women with ADHD, ASD, or both. Nearly 77% of the women reported chronic pain of any kind. 33% of women with ADHD, ASD, or both reported widespread chronic pain, compared with a prevalence rate of 12% in the general population. And 44% of women with ADHD, ASD, or both said they had chronic regional pain, compared with 24% of the general population. The findings appear in the Journal of Pain Research.
And finally today, atopic dermatitis is atopic dermatitis is atopic dermatitis, right? Well, maybe not. In fact, Dr. Kenneth Gordon cautions that atopic derm might not be one disease. That means treatments may need to be adjusted to reflect a patient's age and his or her ethnicity. Dr. Gordon of the Medical College of Wisconsin in Milwaukee spoke at Skin Disease Education Foundation's annual Las Vegas Dermatology Seminar. He says medicine's probably just on the tip of the iceberg of understanding the physiology of atopic dermatitis. Hopefully, that will lead to the kind of therapeutic advances in AD that have been seen in psoriasis. Right now, Dr. Gordon says there's a wide gap between what's known about those two dermatologic conditions. Unlike psoriasis, there's only one biologic treatment for AD, and the AD medicines that are used aren't well understood. Plus, there is division within the field about what drives AD. Is it the skin barrier? Is it inflammation? Dr. Gordon says both are important, but the relative importance of all the potential factors is still to be determined. What is clear is that AD acts differently in certain patient populations. It's not the same in pediatric versus adult patients, and it's not the same in white versus black versus Asian patients. Dr. Gordon explains that the different cytokines appear to play different roles in those populations, and moving forward, it's going to be key to figure out which patients give which AD medications. SDEF and this news organization are owned by the same parent company. And that's it for today's Daily Medical News. Be sure to catch the latest episode of the MD Edge SciCast, which is available this Wednesday and every Wednesday. For MD Edge, I'm Nick Andrews.
And I'm Mary Ellen Schneider. Thanks for listening, and we'll see you tomorrow.